Welcome back. Today is SADC Malaria Day, which aims to create awareness about the disease and mobilize communities to participate in malaria control programs.
Well, according to the World Health Organization, there were about 241 million cases of malaria in 2020. This is compared to 227 million in 2019. The number of deaths stood at around 627,000. Let's speak now on the fight against malaria and misconceptions about the disease. We're in conversation with Dr. Chris van Straten. He's the Global Health Advisor, Clinical Governance at the International SOS. Thank you so much, Dr. Chris, for your time this morning. Let's talk a little bit about this. I mean, one would have expected, particularly the SADC region, to have really made significant progress in the fight against malaria. But judging by the numbers, it would look as though somehow we are tailing behind. Is it a misconception issue? Is it because we become lax in our fight against malaria? Where do you see some of those gaps lying?
Hi, good morning, Faith, and thanks so much for having me on the call. Really complex, really layered. I'm very cautious of pointing the finger left, right, and center because it's really complex. So first off, let's start prior to the pandemic, prior to the COVID pandemic, so 2019, many of us in global health and public health and the healthcare community, we were feeling pretty proud because many conditions like tuberculosis, like malaria, those numbers were stable or coming down. Why? Because we've been using education platforms, follow-ups in clinics, advances in medications, etc. During the pandemic, COVID pandemic, and for many reasons, and it has to do with people not accessing primary care, people not being able to get medications for treatment, resources being pushed into the detection and treatment in COVID, etc. We've seen this spike over the last 2 years. And is it concerning? Yes, it's concerning. But am I optimistic? I am. Why? Because we have new vaccines that are looking really promising. So here it's the RTSS vaccine. We saw data this time a year ago showing a 30 to 40% reduction in malaria, especially in children, after the booster dose. And now, recently, there's the R21 matrix vaccine, which has 70 to 80% efficacy in children at reducing or preventing serious disease. So those are exciting. Plus, we do know that some of the developments in preventing the bites, so mosquito nets impregnated with insecticides or repellents. We know that some of the fumigation techniques for killing mosquitoes before they even get close to us are becoming more and more effective. So yes, we've had a step backwards. I think we understand why. And now we need to have a rally call and say, this disease in Africa kills Africans indiscriminately, and we can and need to do something about that. Thanks, Faith.
Doc, are you finding that, there is now, thankfully, because, COVID-19 isn't as devastating as it was, around the time of the numbers that we are sharing, about 241 million cases compared to 227. Are you finding that now that, it's, I don't want to say being dealt with, but dealt with better, COVID-19, that now the focus is probably a lot better on malaria and what malaria has been doing in this period of COVID-19? Or do you probably find that although, there is the science that is going into it, once again, a lot more, that we're still not giving it the kind of attention that it deserves because the pandemic that is COVID-19 is not over?
Mixed bag. I think the answer is a bit of both. Certainly 2 years ago, or a year back, if you'd said to me, Chris, is COVID drowning out the other pathogens? The answer was yes, in terms of media and attention and funding. However, in the background, academics, institutions like Gavi, with companies like International SOS, have still been looking at how can we access these vaccines, what is the data, and how can we... Here's the thing, you can build an amazing tool or medication, but if you don't get it to the right person at the right time and make people aware of these vaccines and how they work, then you're not going to succeed. So I hear you. It's a very good question. It's a subtle question. And the answer is, I think increasingly we're getting that balance again. And what we've had to teach many of our colleagues and staff working in countries in Africa, and we're very privileged and fortunate that we have several hundred clinics throughout Africa. We've not only had to tell our staff, if someone presents with a fever or a headache and joint aches, I mean, that could be COVID, right? But that can also be malaria. So the two can look very similar in the beginning, and that can be confusing for clinicians and patients. And so we've played emphasis for our staff to say, never just, if the COVID test is positive, you can't just say, well, it's COVID, and I'm just going to treat for COVID. You must always exclude malaria. And in that way, we've actually saved many, many lives, because we've seen this repeatedly where an individual gets COVID. Let's say they're an expat traveling, they pick up COVID in Africa and they fly back to some other country, and there the clinicians don't treat malaria often, so they miss it. And you can end up having malaria and COVID and die from malaria. So, yep, good question. Thank you.
Yeah, Dr. Chris, it also makes me wonder about how, even as a civil society, do we underplay the effects of malaria? So in often cases, you often hear about how somebody may have contracted malaria whilst away on business, or, whilst visiting a different country. They still board a flight. They still come into South Africa. They still come into other countries. They wait until severe symptoms are showcased before they actually seek any kind of intervention health-wise. Even us as people, do we become a little bit, I don't want to say intimidated, or a bit afraid of what could potentially be if we should ever be diagnosed as having malaria?
Yeah, I think you've touched on a very important topic, and something I'm pretty passionate about and spend a lot of time trying to educate people all around the world. I've given some talks to this globally for over 10 years, so a crucially important topic. And I just want to give you an example. One of the first cases of malaria I treated 12 years back, I had the privilege of working in Papua New Guinea, northeast of Australia. And the community brought in a 19-year-old kid. He was the first in his family who was going to go to university and study engineering. He got sick. They took him to a local faith healer who missed the malaria, and they brought him to us. By the time it was cerebral malaria, in other words, it was in the brain and causing clots, many strokes. We did manage to save his life, but only just using artesunate and other types of medications. And the end result, though, is he was paralyzed down the left-hand side of his body and would not be able to go to university. It would need to be fed and cared for the rest of his life. And that's tragic. A and B, completely preventable. So please, malaria, as we said earlier, it can mimic other diseases. It can mimic and look like tick bite fever. It can look like flu in the beginning. But if you pick it up early, we can treat you successfully. And we've treated thousands of cases successfully. And as you said too, prevention. It is so preventable. I've worked in malaria countries for over a decade, and I've never had malaria. Why? I've got all the education. I always take my prophylaxis religiously. All my clothing was permethrin impregnated. I have a mosquito net that I travel with, so I have never picked it up. And there are thousands of us who never have, and we need to keep sharing that message. You can prevent it. It's like wearing a seatbelt in a car. Thank you.
Just before we let you go, Doc, I mean, a lot of people will say that, you're Dr. Chris van Straten. You would be expected to have all of these resources to ensure that you never pick up malaria. And then they would say, what about those that are not Dr. Chris van Straten, who do not have the resources or even the access to the resources or the ability to access those resources? How then do they make sure that they are never affected by it?
Excellent question. I love that question. So first of all, that's part of Dr. Chris van Straten's mission in life, is to make sure that we get this message far and wide. So first off, what you're doing here today is critical. We need to share that message. And to keep it really simple too, we've got a little saying, it's the A, B, C, D, E of malaria prevention. So A is awareness. We need to be on every radio station, every TV station, every community where we have members or colleagues, and it's a network. Globally, you'll see a network. It's a WHO, it's the CDC, it's Africa CDC, NICD in South Africa. We are really on a mission to share good, usable information. Then B is preventing bites, and mosquito nets, they've gone through waves. They go through waves of being fashionable and not, but they work and they're cheap, and we can get them out there, and we're doing that en masse. The chemoprophylaxis gets complicated. There you need to engage with your healthcare provider and decide which one is useful, where and when, depending on where you grew up, your risk profile, etc. And then if you suspect malaria, you must go see a healthcare provider and get access. And then just getting, again, that question's great because it also sets up for, we need to be working on all aspects of health and our community. So it's looking after our environment, looking after each other and those who have lesser access to resources, education, whatever that might be. We can, we must, and we need to redouble our efforts as the COVID pandemic, as we start understanding that better control, we've got to refocus on these other elements too. Awesome question. And I wish we had more time to unpack it because it's a really good question. Thank you.
Yeah.